So good morning, everybody. We're excited to have you all join us at our Health Workforce Council quarterly meeting. We'll be sharing updates and have presenters today. So happy to have you all here. My name is Haley Mears. I'm the Senior Workforce Development Program Manager at the Health Improvement Partnership of Santa Cruz County. And we will jump right in. So let's go to the next slide. And Maria, quickly introduce yourself.
Thank you, Haley. Hi, everyone, and welcome. Good morning. My name is Maria Estela Jerezano, and I'm a program coordinator with the Health Improvement Partnership. So as we get started, if you can please share your name, role, and the organization you're with in the chat.
So our agenda today, excited to share, we will have presentations from Futuro Health about their new surgical tech program. And then we'll have an update from folks who are working on the Central Coast K-16 Regional Collaborative. So we'll have pretty robust presentations, and then we'll have some time at the end of our meeting to share our Health Workforce Council quarterly updates from each of the work groups that we have. We have five active work groups right now. And we'll share a brief recap from our HIP community forum that was just held last Thursday. So with that, I'm going to jump right in and go to the next slide, please, just so we can introduce our presenters. We have Lonnie Mills, the Director of Experiential Learning, and Tracy West, the Apprenticeship Leader and Program Manager for the Surgical Tech Program with Futuro Health. So I'm going to hand it over to you, Lonnie and Tracy, and thanks for joining us today.
All right. Thank you, Haley. We appreciate it. We're super excited to be here and tell you about our programs and what we could potentially do to help fill the workforce gap, especially in the surgical services piece. So if you have any questions or anything, we're happy to answer them. And we're happy to give you our email addresses, things like that. So we'll get started. Next slide, Maria, please. So I just want to talk about our mission. So for Futuro Health, we take our mission very serious. We are a nonprofit organization, and really we're about improving the health and wealth of communities by growing the healthcare worker network in all of the communities that, you know, they don't have the access that some of the bigger areas do and things like that. And Santa Cruz fits that perfectly. So you are right where we want to be, right where we want to help. So we have workforce solutions in a multiple different ways that can kind of help. So we'll talk about that. Next slide, Maria. So these are just some Futuro Health scholars that have gone through our programs that are from different communities. So we just wanted to put a face to the program so you could see that we have real life people. But it just gives you an idea that, you know, we have a pretty diverse community of scholars that we pull from. Next slide. So this just kind of goes into this as well. So we're very ethnically diverse. We have bilingual people as well. We have female and male, and 31 is our average age, which we always find interesting. It's not people straight out of high school. It's people that are usually looking at second careers, or maybe kids have grown and gone, things like that. So it's kind of an interesting age. Next slide. Our CEO, Vaughn Quinovan, sorry, I always struggle a little bit. She has actually been recognized by many different organizations. She's had global and national recognition. She's worked with the National Governors Association in Wyoming. She's actually spoke at the World Health Organization regarding, you know, the workforce gaps and how it could be closed, what we could do in healthcare to make it better. And she still continues to have podcasts, things like that, interviewing leaders in the healthcare industry. Next slide. So these are the programs and training opportunities that we do have available. The one that we're going to primarily talk about today is the sterile processing technician and surgical technologist. And the reason that is a lot of the times when you pull to your surgical technologist programs, typically you pull from your sterile processing departments. That seems to be the trend, which makes sense. They've already got experience. They've already got the sterilization piece done or good knowledge base. So it makes sense that they pull. So how we look at it as is we can fill both those areas, because once you pull from sterile processing, now you've got holes in your sterile processing. So we can use externships to fill sterile processing, and then we can use the apprenticeship model to help bring in your surgical technologists and get them skilled up and trained and certified for your facilities. Next slide. So we changed our verbiage quite a couple of years ago. We used to call them students. We've actually changed it to scholars because that's really what they are. They're learning, they're continuous learning. So it's really about having a scholar journey and not a student journey. Next slide. So we start, all of our people go through Human Touch Healthcare. It's a 6-week course, and in there they learn how to have those soft skills that we see that are missing so much in the healthcare field. We've gotten a lot of feedback that this has made a huge difference in the scholars' lives and in when they see the scholars go into the healthcare facilities. So within Human Touch Healthcare, we teach them about ethics. We teach them about teamwork, how to communicate, right? How to take feedback and be able to process that feedback and use it to make it better, to make yourself better. How to have empathy and compassion without having compassion fatigue and burnout. And then emotional intelligence. So Human Touch Healthcare throughout the 6 weeks, it's very interactive. They have live sessions, and there's a capstone that they have to complete in order to graduate from that course. And everybody goes through it, and it does make a huge difference. Next slide. So this just kind of gives you an idea of what our end-to-end scholar journey looks like. We get our applications, they're assigned an enrollment advisor, and that enrollment advisor kind of goes through a few different things, make sure that their life is where it needs to be in order for them to go through this scholar journey. And then we'll put them in Human Touch Healthcare, and they'll start that course. Then once they've ended and they've graduated, then they'll go from an advisor to a success coach. So our success coaches, what they're really there to do is to ensure that they are successful in their pathway or in their learning journey. So it's about, you know, if they need resources, what resources are available here? This is what we have. Hey, you're having a bad day. Let's talk about it. What can we do? Maybe they're having financial issues and they're having difficulty paying for things or getting to their externship site, things like that. So they are really kind of that support system to keep them success, or to keep them moving along so that they can be successful. And we have a lot of resources, and we have an amazing, yes, wraparound support. Exactly. Thank you. Perfect. So, and they're great, and they're amazing people, and they really make a huge difference. Next slide. And then they'll continue their pathway, and then they do follow up with them periodically. Sometimes they meet with them once a week, sometimes it's once a month, sometimes it's twice a month. It's really tailored to what the scholar needs. We also, during this time, we use our externship specialists. We'll start getting involved during their pathway to start talking to them about professional development type of items, you know. What is professionalism? What does that look like? What does that mean in the healthcare setting? What is timeliness? What does that mean? And then talk about, you know, interviewing, interacting. So it's really about developing the professional piece and kind of think of it as like a finishing school for professionalism. That's what our externship specialist does. Next slide. And then once they get to a certain part in their pathway, their externship will begin. And then, yeah, we do have a leadership component that we talk about. You know, this is what you kind of the leaders that you'll see, and then also how you can be a leader. So it's a twofold approach. Once their externship begins, we kind of turn them over to our externship specialists, our externship sourcing specialists, and they follow them throughout their externship, checking in with them, making sure everything's going okay, making sure that they are their needs are being met, that they're having questions answered, that they're having a good experience, things like that. And then also reaching out to that preceptor or the supervisor that's overseeing it to make sure that they're You know, are they having any questions? Are they having any, difficulty? Do they need maybe some advice on how to have those difficult conversations that can sometimes be hard to do? So we not only support our scholar at Futuro Health, we also support the preceptors and the surrounding staff within your facilities, because it's a team. It takes a team approach in order to make these people successful and to make them great employees for you. So next slide. So our whole idea is that we want them to be successfully employed from their externship. So in sterile processing, the idea is they'll do their sterile processing externship, and then the idea is they'll get offered a job, right? Because during that externship, you get to know them, they get to know you. Are they a good fit? Do they, how do they fit within your team? Are they going to meet your needs? Things like that. So it's almost like, really, if you think of the externship, it's like a 400-hour interview, to be honest, right? So you get a good idea of how they're going to fit. So if they don't get employed, we do have other graduate plans that we have to support them as far as getting employment. But really, our hope is they will perform so well in their externship that they'll get a job that way. That's our goal. Next slide. Yeah, exactly. We want them to get that. All right, so externship to employment. And again, this is really kind of getting into the sterile processing piece, because surgical technologists, typically with externships, it can be a little more difficult. It's really better for the apprenticeship model, which Tracy will talk to you about. Next slide. So we can help fill workforce gaps. One of the things that, we run into is there's a lack of externship opportunities, because usually a facility doesn't have enough people in order to oversee the people that they need to bring in so they can fill the holes that they have, right? So it's like this circle that it's hard to break. So we understand that, and that's why we created our preceptor course, our preceptor support, and those items, and brought them in as well, because we understand that. We know that it's difficult when you're already short-staffed to take another person, pull another person when you already don't have enough to oversee somebody. So we want to help support you in that with the preceptor support. So what we can do is we can help get that talent into your pipeline, and we can make sure that, or you can make sure that they're going to fit your needs. Next slide. And by doing this, like I said, it does shorten the hiring process, because, if they do externships, then we already have had the job application, right? We've already kind of interviewed them because they've been there for 400 hours. We know them by now, right? And honestly, we've kind of cut down on the pre-boarding because they had to do all their onboarding before they did their externship. So we've kind of cut that piece down too. So we can shorten the hiring process using the externship model. And the other nice thing, bonus, is orientation's already started. They're already learning your equipment. They're already learning your processes. They're already learning your programs, your computer programs, your charting programs, whatever the case may be. They're already doing it. So it cuts down on quite a bit. Next slide. So we also have created to help with the onboarding, because onboarding is always, it's an animal of its own making, right? Onboarding is always special. So we've tried to streamline it for everybody that we are employment partners. So we have a platform that we use to onboard all of our scholars, and either we can give the facilities access to that platform and they can see all the onboarding, or, we can make sure that all the documents are correct, and then the scholars can make sure that they get sent, or we can make sure that they get sent. But by doing it this way, there's none of this, well, this is too old, this is too late, this won't work. We've already done all that. So onboarding can be streamlined pretty significantly. And we also track their hours and make sure that everything's going the way it needs to. So there's a lot that we've tried to do to help make things easier for our employment partners. Next slide. So again, I was talking about the preceptor support. So we got a lot of feedback about, I'd love to take externs, but I don't have any trained preceptors, and I don't have the ability to train them. So we created a 20-hour course that is developed for our externship partners or employment partners. And we, like I said, we have dedicated staff to help provide that support. And it's really about teaching preceptors how to have those conversations, how to create a positive learning environment, how to have those interactions, how to increase critical thinking, clinical reasoning, so that when they are on their own, they have the ability to think on their own. So, you know, we train the preceptors how to ask those questions specifically, things like that. So we've tried to develop it to really be as supportive as we can. Next slide. So these are just scholars that are in the Santa Cruz County area. We pulled it so you could get a good look at what's available through Futuro Health. So we've got on here, you'll see it says initial admission. The initial admission is they're just getting started in human touch healthcare. They're just getting started in our process. The ones that say enrolled in Gateway program, they've actually finished human touch healthcare and they're getting ready to start their Gateway program. And then program complete is the program's complete. They've already finished. So we have quite a few people in the area. I put other disciplines on here in case there was any interest in other disciplines. I know we're focusing on surgical, but we thought, you know, there's gaps everywhere in healthcare, so throw it out there, see if you need it. So we definitely have the people that we can fill. Next slide. So we want to give you what you need, right? But to do that, we need externship partners. And by getting externship partnerships with our sterile processing and any other disciplines that you might need, you know, we can help you fill these workforce gaps. We can streamline your onboarding. We can streamline your hiring process. There's lots of benefits to having our scholars within your system and getting, having us, you know, partnering with us for externships. Next slide. And this just talks about it. So another thing that we did, because we do contract with multiple education providers, so we have anywhere from 15 to 20 education providers that we contract for various disciplines. So what we did is we came up with what's called a master affiliation agreement. So you only have to deal with Futuro Health's externship team. You won't have to deal with all of the education providers that we contract with, so that if there's an issue, you reach out to one person. If there's an onboarding issue, you reach out to one person. It's not a multitude of people you have to be interacting with. Next slide. So if you want, you know, if you're interested and you want to connect and discuss this, there's my information. Be happy to meet with you, send you more information, anything that you need. We're very excited about this. We've been talking about it for a couple months now, Tracy and I. So we want to partner and give you guys what you need. And Tracy's gonna take over and she's gonna talk about the apprenticeship program. She's our leader in that area and very, very knowledgeable, and she can answer any questions regarding apprenticeship as well. Tracy, you want to take it away?
Sure. Thanks, Lonnie. Hello, everyone. I'm Tracy West here with Futuro Health. I'm the Surgical Services Program Director, also the apprenticeship person that we have here on board. But yeah, I pretty much live, breathe apprenticeships. I love apprenticeships. So yeah, I'm very passionate about them and love the model and the setup and the versatility that it gives employers. So I'm happy to be here to be able to discuss this opportunity and model with you all. Next slide, please. So why apprenticeships? Well, apprenticeships create a win-win situation for everyone involved. So not only the apprentice is, you know, getting paid while they're learning, so a earn while you learn opportunity, but the employer is also benefited as well, because they are able to train in a way that they want to, you know, train using their equipment, train using, you know, their surgeons, but really kind of focus in on training that's going to be best beneficial to them. So it's really creating a win-win situation all the way around. Next slide. All right, so I want to talk about some of the benefits that employers will see with an apprenticeship model. For one, there is a huge cost savings. So, whenever you bring someone in, whether it's the onboarding, it can be fairly expensive, especially if you are, hiring recruiters to try to recruit people in to fill your open position. So it can be really expensive if you are, if you're a traveler or hired travelers in, there's traveling positions are usually a little bit more expensive than your regular position. So it's all revolves in this huge cost reduction by using an apprenticeship model. Also employee retention. When you're investing in someone, and training them and giving them the opportunity to actually earn a wage while they're learning at your facility, you're going to have that employer is going to be more dedicated, or excuse me, employee is going to be more dedicated. They're going to want to stay. You're going to have that camaraderie with your team built, and therefore you're going to be able to retain these people, for a lot longer than someone that's just coming through and then wanting to leave. Next slide. All right, some additional benefits for the employers is there's actually huge incentives that states, especially California, is offering to employers that participate in apprenticeship programs. So you can get money back for, hours for preceptors that are, spending with apprentices. There's also a lot of other incentives that the state is throwing out there on the table, a lot of money involved in it for you to become a partnership with this type of model. So not only are you saving money, reducing all your costs, recruiting people in, but it's also a way to actually bring in some money too for your departments. Next slide. Oh, go ahead. Next. Oh, there we go. Okay, sorry. All right. So a couple of other benefits, a talent pipeline. So as Lonnie was speaking of earlier, and I'm going to kind of concentrate on surgical services. You have your sterile processing department, typically, and then you're going to have your operating room. So what we like to see is, when you have your own talent pipeline, is you're able to cross-train and upskill current employees and move them into other positions. So say, sterile processing tech would love to be in an operating room and work in surgery. Well, we, through, an apprenticeship model, we're able to allow them that opportunity. And also too, they're still able to earn certification. I know that's a big kind of question, and well, can they still earn certification? Are they eligible to sit for their board? Absolutely, because an apprenticeship program is approved through the U.S. Department of Labor. So it is kind of like another way to earn certification and actually get that credential that's needed to be able to work in these departments. So you can cross-train or upskill your sterile processing techs. Maybe you have LPNs that already are in the operating room that you may want to train to be a surge tech and actually earn that certification. You're able to do that through this apprenticeship model. But say you really don't have anybody that's already on board with your company. Maybe you want to hire somebody from the outside to come in and be an apprentice, and you can do that as well. So it's whatever fits the employer, whatever works best for you, you're able to do it with this model. All right, next slide. All right, so there is a benefits for the apprentice as well. So again, and I would like to reiterate, I mean, can you imagine? I wish it was available when I went through schooling, but to actually have an opportunity to earn a wage while you were learning on the job, I mean, what better way to learn? And especially for some of these occupations, surgical tech, sterile processing, these are really hands-on applications that I don't care how long you're in a lab, how long you're sitting in a classroom, you're not actually going to be able to 100% grasp these concepts until you're actually doing it in that environment, hearing the beeping of the machines, hearing the surgeons, hearing the machines that you're using to sterilize instrumentation. So, to really get in there and have that hands-on, that's going to be where your most learning is done at. So, huge benefits for our apprentices. Also, too, that's extremely important is Futuro Health, because we are a nonprofit, we offer full scholarships. There's no cost associated with this. So an apprentice can come through us, whether you hire in from the outside or it's somebody you want to upskill, we're going to come 100% their, the tuition, their books, that we're going to pay for their certification exam fee for their first take. So everything is covered. There's no expense to the apprentice, no expense to the employer. Again, you have that earn while you learn opportunity, and it can be for career advancement. Again, back to the sterile processing tech, maybe wanting to go into, the operating room and be a surge tech. Perfect advancement opportunity. And also back to the credentials, because we know those are super important in the medical field, in the medical world. These programs do allow a pathway to certification, and we all know that certification is important. So next slide. All right, so just a little bit about the specific programs that we're offering. So our sterile processing apprenticeship program, it is approximately 12 months in length, but I want to say this is a competency-based model. So what this means is, as quicker the apprentice learns the skill, the faster they're going to be able to complete the program. So yes, we say it's 12 months, but I mean, in the matter of 4 to 6 months, they can knock this out. They can have their hours in, and then they can sit for their certification exam. And it is the regular certification exam that pretty much most all of our sterile processing technicians have, and that's through the HSPA, and that's the CRCST credential. Next slide. And for our surgical technology apprenticeship program, this one also is approximately 12 months in length. It is also a competency-based model, so it could potentially be a little bit, shorter than 12 months, depending on how fast the apprentice learns their skills. But I do want to point out here, with this program, we do give credit for previous experience in a related field. So again, back to a sterile processing tech, say they want to become a surge tech, well, they already know the decontam, the sterilization parameters, everything that they need to know as far as that. Instrumentation, they already know the names of the instruments and how to handle and operate the instruments. So we're able to give them up to about 6 months of credit for being a sterile processing tech in this program. So, they come in the operating room, they learn their skills, they get it down pat, they're doing what they're supposed to do. 6 months, they're eligible to sit for their certification exam and earn their credentials. So, very awesome, very, unique model, but I mean, that's what we're priding ourselves on, is being able to offer these alternate routes rather than just your, traditional brick and mortar lab, and then, all the money that's associated with it coming out with student debts. This is offering kind of a more versatile, and really we want to put the reins back in the employer's hands. We want the employer to be the ones that have a say in a lot of these processes, and that's just because the end result is the employer doing the hiring. So, we think that the employer should have a lot of say, in how that's done and how training is done, because that's ultimately our goal, is to have people in rewarding careers and, be competent in those careers as well. So next slide. There we go. So to become a partner with us, it's super easy. It's just a little 1-page partnership that you can get with me. And if you're interested in the apprenticeship model, or if you have maybe some people that you know of that maybe is already on your staff that may want to go into the operating room, or you may have some people that you want to bring into sterile processing if you have some of those positions you want to fill. Super easy to become a partner with us, and it just really takes one employer to launch these apprenticeship models and these apprenticeship programs. So again, super easy to do it. All right, next slide. All right, and you can see here my contact information is also in the chat as well. I would love to talk with you further. Again, if you maybe have some ideas where this can fit in to your organization, I would love to chat. My number there, that's my cell phone number. Feel free to call, send a text, email me, but I'd be glad to, and happy to talk further with you on the apprenticeship models that we have to fill these sterile processing, especially surgical tech needs that you probably have. So it's been a pleasure, and I appreciate the time and the opportunity to share this.
Excellent. Thank you so much, Lonnie and Tracy. It's so great to have you guys share this opportunity with our county. We do have time for a few questions. Before we jump into that, I do want to share, we shared at our last in-person Health Workforce Council meeting in June, the process that we had taken as our council to really look into surgical tech options. And this is Futuro Health's program is really what we're looking at trying to implement in our county and in our region. And so myself and Jack, who I think is on this call with the BACC, the Bay Area Community College Consortium, we had several in-depth meetings and got employer feedback from two of our organizations locally. And so we're really excited to bring this to the county, and we hope that organizations will engage with you and that we can get this program implemented locally so we can grow our own in the surgical tech field. So with that, I'll stop and just open it up. We have maybe like a minute or so for questions. And if there's no questions, you can also just, contact Lonnie and Tracy. We've put their emails in the chat, or feel free to just add a question to the chat box while we continue with the meeting. But your presentation was so thorough. Maybe there are no questions at this time. All right, well, we'll move on to our next presentation. So we'll be hearing about the Central Coast K-16 Regional Collaborative from Ashley Selleck, John Leopold, and Dr. Cal Gordon, who are here with us today. And we're really excited to get updates on this regional collaborative project that's been happening for a little while now. So I will pass it over to Ashley, John, and Dr. Gordon.
Hello, everyone. Thank you so much for the opportunity for us to share the great work that's being done in the collaborative. I'm Ashley Selk. I'm the K-16 Collaborative Northern Region Coordinator, and so I'm supporting 3 counties, Santa Cruz County, Monterey County, and San Benito County in this work. We have the director of the collaborative, John Leopold, on the call, and Dr. Cal Gordon, who is one of our industry partners and serves on our steering committee. I'm going to go ahead and hand it over to John to get our presentation started.
Thank you, Ashley, and it's great to be part of the Health Improvement Partnership group. And I'm very excited to tell you about the work of the Central Coast K-16 Regional Collaborative. The Regional Collaborative is trying to do something that is important and surprisingly not done enough. It's a collaboration that started in funding derived from the state of California as they created regions after receiving COVID relief funds. And so this is part of the California Economic Recovery Fund. And so it's called a SURF region, and it makes up the 6 counties of the Central Coast from Santa Cruz to Ventura. What we are trying to do is break down the silos that separate all the public education institutions along the Central Coast. That's the over 30 K-12 districts, the 8 community colleges, the 3 California state universities, and the 2 UC campuses. If you go to the next slide, you'll see that, oh, that's not the actual next slide that I had. So I'll talk about this then. The collaborative came together nearly 3 years ago and began to look at labor market information to determine what were the jobs in demand along the Central Coast. And after looking at that information, the collaborative chose 3 areas. One was in healthcare, one was around computers and engineering, and lastly, education with a STEM focus. We looked at those jobs as both having many openings, but also the kind of jobs that could pay family supporting wages. Next slide. The reason why we are doing this is because when you look at the economic information of along the Central Coast, what you see is over 500,000 students. As you can see in this slide, 65% of them are Hispanic or Latinx, but in high school. But what we know is that as they move through the post-secondary institutions, their percentages become less and less. And they make up about 44% of the student body overall. And so when we look at issues around poverty, we see that they're overrepresented in statistics about poverty and underrepresented in the statistics about education and persistence and graduation. Next slide. Our steering committee is made up of roughly 30 people. That includes all the 6 county office of educations, 4 K-12 school districts, all 8 of the community college districts, the 3 CSUs, and the 2 UCs. We also have industry representative, of which Dr. Cal Gordon is one of our industry representatives, but we also have folks from the data science, computers, and also the education with the STEM focus. We do have 3 tri-chairs. One is Maria Rocha Ruiz, who runs the Educational Partnership Center at UC Santa Cruz, our own Matt Wetstein at Cabrillo College, and Oscar Hernandez, who operates an amazing K-8 district in Ventura County called the Rio School District. Next slide. This gives you an idea of what we have worked on so far. The planning actually began nearly 3 years ago, but in October 22, we received funding from the state to really do some more planning on this. That is when we did the labor market research and selected the pathways. We then received an implementation grant from the state, and we made our first allocations of funding in April of this year. And right now we are in the process of allocating another amount of funds, about $6.5 million in our second round of funding. Our goal is by the June 30th, 2026, we will have 2 clear occupational pathways as we seek to build these career pathways for underrepresented students along the Central Coast. Next slide. I'm going to turn it over to Ashley Selk, who's been doing an amazing job as our Northern Region Coordinator. Ashley.
Thank you, John. So a little bit more about the collaborative. We are a data-driven, equity-focused collective initiative made up of industry partners, K-12 schools, community colleges, and 4-year universities. Our focus is really to decrease barriers and pathways in the Northern region for Cycle 1, focused on healthcare, specifically for our socioeconomically disadvantaged students. We do have an equity subcommittee that works closely to make sure that we are indeed creating equitable pathways for our socioeconomically disadvantaged students. Next slide. When the collaborative was first established, the equity subcommittee came together to create a North Star and a Near Star, which we do use to drive all of our work. As I mentioned, our focus is historically marginalized students in the entire Central Coast and making sure that they can secure high wage, high impact careers to advance opportunities for upward mobility. And then also our Near Star is to make sure that all of our practices are truly data informed and equity driven, with a focus on opportunity gaps and funding those to make sure that our students are persisting in higher education and also obtaining careers for upward mobility. Next slide. So some of the goals of the collaborative are to really increase alignment for our K-16 educational systems. It's quite innovative to have K-12, 2-year, 4-year, and industry partners all at the same table, creating pathways for students. And so we're really looking to continue to set that table and inviting the right folks to increase alignment to make sure that pathways are easy for our students to maneuver. Our second goal is to really disrupt inequitable systems and structures that we have in all of our institutions. And so these are discussions that we continue to have as we're looking at barriers and opportunity gaps for funding. We are grounded in research and deep listening. We're currently doing focus groups around journey mapping with our districts to make sure that we are hearing from our students, our parents, and then all of our leaders in industry. And then we're really focused on building our programs around student strengths and assets. We know that we have rich cultural and linguistic contributions from the folks in our community. And so that's a key focus and one of our goals for the collaborative. Next slide, please. So our 3-year objectives for the collaborative are, number one, to really cultivate an inclusive, engaging, equity-oriented learning environments for all of our students in the Central Coast. Our second objective is to retain students through inclusive support, making sure that there are wraparound support systems in each one of our intersegmental partnerships. Objective number 3 is to provide high-tech, high-contact advising, and making sure that pathways are clear, students understand how to move on to the next step, and that they're also being advised properly in each one of the segments. Objective number 4 is to really support college preparation and early credit. And so there's lots of work being done between K-12 2-year and 4-year to make sure that early credit dual enrollment is in place for our students. And then our final objective is really to make sure that we implement at least 2 aligned pathways in healthcare, engineering, or STEM education. Next slide. So the governance structure of the collaborative is 3-part. We have a regional leadership team that's made up of K-12, 2-year, 4-year, and industry in the entire region. We have a steering committee, which John shared that information with you. And then we have working groups. So our current working group that's doing a lot right now is our equity subcommittee. Go ahead and move on to the next slide. So the backbone structure for our collaborative is interesting and quite innovative. So our fiscal backbone and our project director are housed at UC Santa Cruz. I'm the Northern Region backbone. I'm housed at Santa Cruz County Office of Ed. Our data and research team is at Cabrillo College, and then my Southern counterpart is housed at UC Santa Barbara. Next slide. So a little bit about our funding allocation strategies are, we wanted to make sure that when we're funding initiatives that we're funding innovative efforts, that we're funding professional development, and then also really creating availability and access to dual enrollment. So making sure that we're funding release time for folks to plan for that. Also community engagement. We have some health speakers series in the Northern region that we're funding. And then also pathway mapping, which is something I'll share with you in just a second. We can go ahead and move on to the next slide. So John mentioned the selected pathways that we're focused on in our region. Go ahead and move on to the next slide. So a real primary focus of this work is to create student journey maps. And the state has told us that in order to have a fully established pathway, we need to have these 5 different things. So the first one is industry connected courses. So we have brought industry leaders into this work to let us, to advise us around courses. And then the second piece is employer commitment. And that's something that we hope to continue to increase, but making sure that there's a commitment for employers in our region and our partners to hire our students after they've completed their pathways. Another really important piece of pathways is work-based learning opportunities. And that's one of the asks that we have for all of you in just a minute, is to make sure that there's work-based learning opportunities for students in K-12, 2-year, and 4-year. And so that's something that we want to increase and create activities around. And then pathway roadmaps is something that we've been working with all of our partners, and I'll show you an example of that in just a minute. And then also making sure that we have articulated agreements between all of the institutions. So that's an easy segue between K-12, 2-year, and 4-year. You can go ahead to the next slide. So here is a very draft form of a pathway, a student journey map that was created with PVUSD, Cabrillo College, CSUMB, and UC Santa Cruz. As you can see, we jotted down at the bottom several employment opportunities for our students, and we have since narrowed that down to be K-16 with a focus on RN. And so you can see that each one of the intersegmental partnerships are represented on here. So PVUSD has patient care CTE program, which would lead into an LVN program, to an RN program, to a BSN program, and take students to some of these different careers. And then, as you can also see on a journey map, we have dual enrollment opportunities listed, and then some work-based learning opportunities that students are currently engaged in each one of these intersegmental partnerships. So as I mentioned, this is very draft form. We are in the process of getting feedback from students and parents and all of the intersegmental partnerships to create a student-facing, parent-facing, probably counseling tool that students can use to understand the pathways that we currently have in our region. Next slide. So some of the benefits of participating in the K-16 collaborative are really collaboration. That's what I continue to hear, the partnerships, the relationships that are being built within each of the intersegmental partnerships is a great benefit, because it's an opportunity for folks to leverage other funding sources as well. There's also time put away for organizational planning and implementation, and our backbone team is supporting that. So we're heading out to different districts in our region to make sure that we sit down with all intersegmental partnerships and are planning pathways for students. And then also the funding aspect of it, our funding activities that align with our pathways for several institutions in our region. You can go ahead and to the next slide. So one of the asks that we have of this group and future medical groups that we're going to be speaking to are a need for clinical experiences for our students. So with this collaborative, there is going to be increased demand for work-based learning in each one of the segments that I spoke to. So we're going to need to establish more partnerships between the medical community and the educational systems. And so that will be an ask that will be coming. We want to make sure that we can provide students with clinical work-based experiences to engage them with medical professionals, to create mentorship and shadowing opportunities for our students and local healthcare industry. And then also student interest and demand in these clinical experiences is definitely going to increase as we can continue to make these pathways. All right, I think that is the end of, I wanted to talk about some of the projects that were funded for Cycle 1. So we did fund a dual enrollment initiative, some elementary college exposure visits, especially in healthcare, for fourth graders to visit community colleges and to learn more about higher education. We have some high school exposure activities. We're going to do some career speaker series in Pajaro Valley Unified School District. Work-based learning opportunities is something that we funded, and then a healthcare speaker series. I'm going to pause, and I'm going to hand it over to Dr. Cal Gordon to see if you had anything else that you would like to add.
Great, thank you, Ashley. A couple comments. First of all, Cal Gordon, Pediatrics, Deputy Health Officer for Public Health, and also the physician lead for the primary care workforce effort. Two things. One is I've been working with the HIP workforce effort now for about 20 months and about 7 or 8 months with the K-16 regional collaborative. And I find that both efforts are very much aligned, that the values of this are similar, that the outcomes are very similar. What I see is really this major effort, depth and breadth for the collaborative in terms of structural changes and connections with the different educational entities to make sure that we have a process that will support the students in terms of their career opportunities. I think it's really important for us to understand and develop some kind of role clarity as to how we can support each other and align our efforts so that we're working in a very collaborative fashion. And I think HIP is unique in that when you talk about industry partner, that's us, HIP. It really is the medical community for Santa Cruz County, and is really the opportunity to kind of bridge with the various medical organizations to increase clinical experiences. And it will be our organizations that will reap the benefits of this particular effort, in addition to the students that go through these programs. So I think that's it. And I would also want to comment that we are already having challenges providing adequate capacity for our clinical experiences for the current programs that we have in place. And this sort of the collaborative effort is going to raise sort of the expectations on the students' part. A lot of desires to get clinical experiences. And my biggest fear is that we won't be able to provide those experiences for our students. And so I think that is the primary focus that we want to talk about. And I think where HIP can be helpful. No other county has something structurally that what the HIP offers, where we bring all of our medical organizations, clinical community together on a regular basis. And I think we need to have a real concerted effort to see how we can increase the clinical opportunities for our students. And I think that will be our challenge. And I'll leave it at that.
All right, well, thank you for that presentation. We have a few moments to pause for questions, if there are any questions for Ashley, John, or Dr. Gordon. I think one thing that would be helpful, Ashley, is if you could share your contact information in the chats, just so anyone who is listening today, if their organization wants to get more involved as an industry partner in this work, they could reach out to you directly. And okay, great. Yeah. And I think my question, which might be, a pretty big question, is thinking about clinical placements and work-based learning opportunities. Will this collaborative be putting something together for employers, kind of like how Futuro Health just mentioned they have that 20-hour preceptorship training, something like that helps the organizations actually provide a really meaningful work-based learning experience?
That's a great question, Haley, and I think that's something that Dr. Gordon and I have talked about as far as onboarding and such with students. So it's something that we will work on.
Excellent. I'm happy to help with that. Volunteering. I see another hand raised. Grant.
Yeah, so Grant Hartzog, UC Santa Cruz. We've run a internship program for students interested in healthcare careers for years now. And capacity is always an issue, as Dr. Gordon mentioned. And I think it would be interesting from hearing from the healthcare providers of where your pressure points are, and how we could make it easier or more efficient to get students into these sorts of activities. I think we heard some great ideas from the Futuro Health people today, but if there are particular issues that really limit your ability to take apprentices or interns, I think it would be wonderful if we could know about that. And you can always contact me or Dr. Gordon offline as well if you have ideas. I'll put my email in the chat.
I would just add that Grant is also part of the collaborative initiative, and he's been a great partner in terms of creating opportunities. We have a number of successful models that that support the UC Santa Cruz students, and I really appreciate his leadership and his partnership. And he has been part of the HIP council, the sort of executive council for, I guess, about a year now.
Great. Any other questions before we move on to our last segment of the meeting? And I think also if you have a question that comes up, you can also put it in the chat and it can be answered that way as well. All right, well, we will move on to our Health Workforce Council updates. I'm really happy to share, for a while, we didn't have a facilitator for our integrated behavioral health workforce work group, and we now do. He was here earlier, but had to leave. So Patrick Meyer, the director at Cabrillo College's Human Health Services Department, is now working with us on our monthly work group meetings. And I'm excited to share that what's coming out of those work group meetings right now is Cabrillo College and Santa Cruz City Schools are working on developing a dual enrollment human services course for high school students that would be hosted most likely at a high school location. And this is an opportunity for high school students to learn more specifically about behavioral health careers and develop a pathway for them to explore all the opportunities that there are in behavioral health careers. And once that program or once that course is launched, we will definitely be reaching out to this council to invite guest speakers and field trip site locations and organizations to engage with that course. So we're really excited about that. Stay tuned. And then we also will be hosting this this October our integrated behavioral health workforce convening. So that's an online meeting. It will be October 24th, 10 to 11:30 online. And the theme for that meeting will be around case management and lay counselor academies. We'll have two guest presenters present in those areas. One will be Holly Hughes with her Case Management Academy, and the other will be Elizabeth Morrison with her Lay Counselor Academy. Those are virtual training opportunities in behavioral health. And then HIP is a vendor through DHCS Technical Assistant Marketplace. So there are opportunities for organizations to get fully funded to have their staff attend those two academies. So we'll be providing also an overview and information about how organizations can engage with the TA Marketplace funding for their staff. And these are opportunities to train and upskill staff. Our medical assistant work group, Ashlyn, do you want to speak on this? If you're still here. Okay, I'll go ahead. And if you unmute, feel free to chime in. So our medical assistant work group, we actually hosted our first in-person work group meeting. It was at Cabrillo College, hosted by Ashlyn, and it was a really wonderful event and time for our work groups who we always meet virtually, having an opportunity to meet in person over lunch and have a really engaging discussion. It was really focused on the Cabrillo College's training program and for the employers to provide feedback and input on the training program. So we had a really robust dialogue, which was really great. And then also employers were able to see the training facility for the medical assisting program. We're going to continue those in-person work group meetings at our other two training locations. So we will have, oh, hi, Ashlyn, do you want to say something?
Hi, no, thank you. I was hearing you. I had to take care of something else at the same time, but yes, no, great job. I just wanted to really highlight how successful it was to come together in person, just like you were saying, and how I'm looking forward to doing the other site visits as well. So that was very successful. Thank you to everyone who contributed to that.
Absolutely, yeah. So we'll continue the work group meetings with the Watsonville, Aptos, Santa Cruz Adult Education, and Santa Cruz County Office of Education programs. Those will be in November and December. And those are open to anyone who really is interested and wants to participate. If you are not in the medical assistant work group, but you do want to come do the site visit and meet in person and learn more about the programs, Maria will put her email in the chat and you can email her and she will make sure you get calendar invites. So we'll go to our next slide, which is just, it's just a photo of the group. There were actually, next slide, please. Yeah, so photo of the group. This was our in-person medical assistant work group. There were actually more people at the meeting, but they were so engaged in conversation, we couldn't get them to come over and take the photo with us. But that's actually a sign, I think, that we had a really good turnout and it was a really meaningful meeting for everybody. So this was on August 23rd, and that's the Cabrillo College training facility in the background there. Next slide. I'm going to let Cal actually share some of the updates in the primary care pediatrician work group since you're here with us today.
Great. Thanks, Haley. So I asked Haley and Maria, they might drop an article from JAMA that I would share with you that kind of outlines sort of our challenge. For the first time ever, our pediatric residency programs are not getting filled, as well as our pediatric specialty fellowships. And that isn't going to spell things in for us in the future in terms of not having sufficient candidates. We already have a shortage of primary care graduates coming out of our residency programs. I know of organizations in our county that have waited more than a year or two to try to fill some of their pediatric family medicine programs. And so that is a major challenge for us. And so more to read if people have an interest. The other flip side is that 40% of our pediatric and primary care workforce are 55 years of age and older. Half of those are 65 and older, and so they will be leaving. And so it's actually going to be getting worse as opposed to better. And I personally believe that there'll have to be national changes in terms of creating incentives for people to go into primary care programs if we're going to be successful on a national level. So locally, our workforce is focused very much on the K-16 Regional Collaborative and seeing how we can support that effort, and most specifically focusing on the different clinical experiences that we can actually create. And part of this is coming up with actually a list of all the different programs that are we would like to see potentially take place in the different workforce. We have a lot of successful models, but trying to really connect that to the sponsoring school, the connection, so that we have a menu for different employer groups. They could see which model works best and who they would want to contact. We know for a fact that different medical organizations have a shortage in different areas. This is above and beyond just the physician or higher education areas, but all the things that HIP has been focused on to see if we can create a broader opportunity for our workforce. And so that is where we're going to be spending a lot of our time and effort. And we did have the opportunity also to get in front of our HIP Council, where all the medical organization leaders meet to talk about what's happening and what our needs are. So more to come on those.
Great, thank you. I have in here too just a bullet point about the UC Santa Cruz Silicon Valley Extension. They now have launched a pre-med post-baccalaureate program. Grant, since you're here with us, do you want to quickly say anything about that? I know the primary care work group knows about this program, but I wanted to share this with our larger council today.
Sure, thanks, Haley. So just real quickly, the goal of this program is to get students from medically underserved communities into medical school with the idea that those are the people who are most likely to come back and practice medicine on the Central Coast. So there's a focus on identifying students who come from the region or from medically underserved groups. We recognize that many of those students, come from poor families, so we're providing scholarships to 10 of the 14 students that we admitted in our first class. The program officially begins a week from Saturday. It'll be housed down at the UCM Best Center in Marina to make it more accessible to students who come from South County, Monterey County, San Benito County. And we're actively exploring partnerships with Natividad, Salinas Valley Hospital, Kaiser to provide clinical experiences for these students as well. The program's intended for people who've recently attained their four-year degree and either need a little more coursework or mentorship in putting together a successful application for medical school.
Great, thank you. And then last but not least, we've added the link in here just for the Career Pathways Health Industry website that the Santa Cruz COE has been working on. And so we will share the presentation slides and this meeting recording with everybody. And it's also posted, it will be posted to our webpage, which I shared in the chat. And we always post our recordings and slides to our webpage. So if you ever want to go back and see a meeting you missed, those are all in there. So our nurse work group is our facilitator is Jo Kafara with the Hospital Council. She was on earlier but had to leave. So quickly, I'll just update this work group right now. We did a survey of our CNOs and nursing leaders and nurses across Santa Cruz County regarding what areas of advocacy this group would like to focus on in 2025 after the elections. So we narrowed it down to healthcare workforce housing and increasing clinical placements. And those are areas that this work group will continue to discuss and develop advocacy campaign with the Board of Supervisors in Santa Cruz County. We also have been working on a grant for public health nurses to attend 1440 Multiversity Healing Our Healthcare Heroes Retreat. We were able to secure a grant last year and send about 50 nurses. And so that is still pending. It looks like the date may be in later this year in November or December, but that's been in the works. And so we'll definitely provide more updates on that as we learn more from the funders. We go to the next slide. And I want to pass it over to Adrienne Saxton to share about the Monterey Bay Community Health Worker Collaborative.
Hello, everyone. Nice to be here. Thank you, Haley. We have successfully started, actually, it's 13 CHW apprentices this fall. They're employed at Encompass, Salud para la Gente, People First, and PVPSA. We'll be working on, currently we're building opportunities with Sarah National Community Action Board and Santa Cruz Community Health Centers. So we're really excited about this new addition to our the apprenticeship as a new addition to how CHWs can be connected to the workforce. And then we've been looking at an online platform for employers to use to hire, to post positions, and also for CHWs to use to get support in order to get those positions. That platform is called We Pair Health. And we've been kind of struggling with coming to a decision about it. So that hopefully is going to be decided soon as we continue to just understand more about this platform opportunity. Another thing we've been update is that we are partnering with Salud para la Gente right now to highlight a day in the life of a CHW with a video. And so we're really excited to be building a video opportunity, to create a video that shares the experience of a CHW at Salud para la Gente, and hopefully we can use that to promote and support the CHW workforce. It's interesting, Haley, I didn't have this listed as a thing to add, but we are developing a training for our CHW apprenticeships supervisors. So if you want to be part of that, I'll add you to that opportunity. So yeah, we're basically we're in a collective with Berkeley City, and they've created one, and so we'll be adapting the one that Berkeley City used to our region. So that's the updates. Thank you, everyone, and if you have any questions, don't hesitate to reach out. I'll put my email in the chat.
Excellent, thank you. That's exciting to hear about the apprenticeship training. So I'll definitely connect with you on that offline. So, and then last but not least, our surgical tech. As many of you know, we don't really have an official work group, but it's something that a few of us have been working on. As I mentioned, Jack Michael with the Bay Area Community College Consortium and other employers that we've interviewed. So at this point, our endorsement or our recommendation for Santa Cruz County is to work with Futuro Health on their surgical technician program. And our next steps will be to invite Futuro Health to present at our HIP council meeting and share this information a little more widely with our HIP executive board members. So we're excited about that opportunity and so glad that Lonnie and Tracy were here with us today. We can go to the next slide. So I'm just sharing a little outline of what the rest of the year looks like for our Health Workforce Council. We started a listening session for our second listening tour. Maria and I have reached out to many of you and scheduled interviews to discuss the Health Workforce Council's effectiveness and sustainability plans. So we'll be finishing those this month and compiling our findings in September. As mentioned, we have the Integrated Behavioral Health Workforce convening in October. That will be online. And then we'll have in-person medical assistant work group meeting with Santa Cruz COE November 13th. The Health Career Expo, November 15th, that will be at Cabrillo College. I'll talk about that in just a moment. And then in December, we'll have another in-person medical assistant work group meeting at the adult education facility. And then last but not least, we will have our final Health Workforce Council quarterly meeting of the year. I'm excited to share, we've already got a theme for that, and it will be about best practices and setting up a clinical placement training program. We'll be bringing in PVPSA and Santa Cruz COE, who already have established training programs, and they're going to share basically like how to set this up, how to do it right. That date's to be determined. We are looking at the option of actually hosting another in-person Health Workforce Council convening. The one we held in June was really successful, and I think everyone really enjoyed meeting in person and having time to chat over refreshments. So we will be sending an update about that as we figure out the time and location. If you want to participate in anything I just mentioned, anything on this slide, please do email Maria, and she can send you calendar invites for all of these meetings and events that are happening. Let's go to the next slide. We're almost done wrapping up here. So I just want to briefly mention the Health Career Expo. We hosted this last year with Your Future's Our Business and Cabrillo College. It was a really successful event. We're hosting it again. I say we, but I mean Cabrillo is really hosting it, and Your Future's Our Business and HIP is really supporting the planning and outreach for this event. So Your Future's Our Business will bring in high school students across the county to Cabrillo College, where they can meet in person with healthcare organizations, learn about all the different careers in health, and also tour Cabrillo College's allied health facilities. So the request really is for employers to sign up so you can engage with youth across the county and attend this event. We will share the sign-in sheet in the Zoom, and we've also emailed it out, so everybody should have access to that. It's a self-sign up, so you can just register your organization by signing up on the sheet. So that, next slide, please. I'll hand it over to Maria.
Thank you, Haley. That's actually a perfect segue into a few next steps that we have listed. So as Haley mentioned, Your Future is Our Business and Cabrillo are hosting the Health Career Expo at Cabrillo in November. As she mentioned, there's a tabling opportunity for you and your organization to share career opportunities to high school and college Santa Cruz County students. In a moment, I will share the link so that way, to that tabling opportunity, so that way you are able to sign up or, feel free to share it with your colleagues. But before that takes place, HIP will be hosting its quarterly Integrated Behavioral Health Action Coalition convening on Thursday, October 24th, from 10 to 11:30 in the morning. Again, this meeting will have presentations on the Case Management Academy and Training, the Lay Counselor Academy and Training, and the Technical Assistance Marketplace. We hope that you can join us, and I will also be sharing that Zoom link in the chat. Lastly, our last quarterly Health Workforce Council meeting for the year will be taking place in December. As you can see, the date and location is to be determined, so please stay tuned for those updates. And I'm sharing all the links that I just mentioned. So HIP's community forum took place last Thursday, and it was actually a great success. As you'll see on your screen, we have a few snippets from that day. 42 healthcare students were invited to attend with comp tickets courtesy of some of our sponsors. The schools that were in attendance were Cabrillo, UCSC, the Watsonville Altos, Santa Cruz Adult Education, Watsonville High School Health Academy, and Costanoa High School. The forum featured HIP's founding members and the keynote speakers community weaving framework. More information about the event, as well as the video and pictures, will be posted on our website, which I have also shared in the chat.
Great, thank you. So that's really all we've got for now. As mentioned, our next steps for you are to join us at our Integrated Behavioral Health convening, sign up to register for the Health Career Expo to attend in November, and then just stay tuned about our next quarterly meeting in December. And so with that, we will just say thank you for participating. We so appreciate your partnership and collaboration. And we will email out the slides and the recording, and it will also be posted to our webpage. So thank you all for joining. We'll try to give you back 10 minutes of your day, and see you next time. Take care, everybody.
Thank you.